Hey guys, Oscar here with Gastroenterology Simplified. I hope you're having an amazing day today. And today we are going to talk about peptic ulcer disease. I want to put a disclaimer. I want you to understand that this video is for educational purposes only. Please always consult with your medical doctor anytime you have any questions or you have any symptoms that could relate to this. Let's go ahead and start. What is peptic ulcer disease? Peptic ulcer disease is pretty much erosion, gastritis, or an ulcer of the gastric mucosa, the upper GI system. What causes peptic ulcer disease? Peptic ulcer disease is usually, the most common cause of it is H. pylori, which is an infection, it's a bacterial infection, or the use of NSAIDs, such as Aleve, ibuprofen, BC, Goody powder. Clinical manifestation. How does the patient present to the clinic or the hospital? Usually the patient presents to the clinic with epigastric abdominal burning, epigastric abdominal pain, nausea. Epigastric abdominal burning and pain usually worsens when the stomach is emptied. The patient may also experience dark stools or coffee ground emesis. And when you palpate to the epigastric area, the patient usually has significant tenderness to palpation. How do you diagnose peptic ulcer disease? The gold standard diagnosis is an upper endoscopy. An upper endoscopy is a scope that goes down the mouth, through your esophagus, the stomach, and it takes a look at your stomach. And what we're trying to check is for gastritis, gastric ulcers, duodenitis, duodenal ulcers, and we take random biopsies while we do this test. Treatment. You have to stop the offending agents. Usually the agents are Aleve, ibuprofen, BC Goody powders, smoking, alcohol intake, and so on, just to mention a few. Once we take the biopsies, we await for the results of the pathology report. And if the pathology report is positive for H. pylori, then we manage the infection, usually between 10 to 14 days with a triple or a quadruple therapy, usually an acid-reducing medication plus antibiotics. In addition to that, let's say that the H. pylori is negative, then once again, you have to stop the offending agents and you have to start either pepsin or omeprazole, pantoprazole, and so on to heal the gastritis, the gastric ulcer, and so on. Peptic ulcer disease could have complications. If the gastric ulcer is perforated, then surgical intervention is needed. Or if the gastric ulcer is persistent, sometimes you may need surgical intervention to take out that part. But this is quite rare. If you found this video helpful, educational, please click like, subscribe, so I can bring you more informative videos. I want you to understand that this video is intended for nurse practitioners, physician assistant students, medical students, and the general public for educational purposes only. Always consult your medical provider. I'm a physician assistant, but not your physician assistant. I hope you're having an amazing day, and I'll see you in the next one. Bye.